Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Module 42. We're going to talk about systemic mycoses. These are very clinically important mycoses, and they'll show up frequently on the test. We'll talk about histoplasmosis, we'll talk about blastomycetes, we'll talk about coccidiomycosis and paracoccidioides. These are important clinical diseases. We'll go through each one of them, talk about their clinical features, how they present, and what we do to diagnose them. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 42, and we'll discuss the systemic mycoses. The systemic mycoses are all caused by dimorphic fungi. These are infections that originate primarily in the lung, but then spread to many more organ systems. Again, they're dimorphic and they change depending on the temperature. The four species we're going to talk about include histoplasmosis, blastomycosis, coccidiomycosis, and paracoccidiomycosis. This figure shows the different shapes of each of the systemic mycoses. Since these diseases can frequently be seen, you will see pictures of them and have to identify them from them. Fortunately, they each have distinct appearances. With histoplasmosis, you're looking for a macrophage filled with histoplasma, as this figure shows. They'll also give you a history of somebody from the Ohio or Mississippi River valleys, as we'll discuss in a moment. Blastomycoses usually have a broad base budding yeast form, so you'll see a big yeast with a small little base coming off of it. Coccidiomycoses are larger, they're 20 to 60 microns, and these are spherules which are filled with endospores. Finally, paracoccidiomycosis has my favorite shape, which is the budding yeast with a captain's wheel formation. It's pretty distinctive and hard to miss. If you'll just associate paracoccidiomycosis with this shape, you'll probably do okay. Histoplasma capsulatum is the first fungi we're going to talk about. It's frequently found in the Ohio and Mississippi River valleys. You have spores which are engulfed by macrophages, and you have an asymptomatic primary lung infection. Some people will get pneumonia if you have enough exposure. We get it from inhaling spores which come from soil which is enriched with bat or bird droppings. After the primary infection, you can get disseminated disease, especially in the immunocompromised. We can find the organism in the reticuloendothelial cells of the liver, spleen, and lymph nodes, also in the bone marrow. You'll have a characteristic picture of microconidia with septate hyphae. This figure shows what they look like in the environmental form. When you find them from the tissue, again, you'll look for the macrophage with hundreds of little histoplasma inside of them, or these little yeasts. Histoplasma capsulatum can have multiple tiny yeast forms within macrophages or neutrophils, as shown in these figures. You can also detect it with the histoplasma urine antigen. It's the best test for disseminated disease and for follow-up during treatment. You can use serology for pulmonary and chronic disease. You have a picture here of somebody's optic nerve, as histoplasma can cause eye infections as well. Question. A 54-year-old farmer in rural Pennsylvania presents to his physician with a chronic cough, fever, malaise, and he's got a lung mass with hilar lymphadenopathy. Biopsy of the mass demonstrates multiple tiny yeasts within macrophages. Which of the following is the most likely diagnosis? This is a good question to go back and remember later. We just barely talked about how the macrophages engulf histoplasma, and so we know this is histoplasmosis. Without the biopsy information, it could be any number of things causing a cough, fever, malaise, and a lung mass. But once we know we have tiny yeasts inside macrophages, there's nothing else that it's going to be. Next question. A fungal infection acquired by contact with bat guano and forming destructive calcified lesions in the lung, similar to tuberculosis, is characteristic of which of the following? So again, in this question, the key is that we know that we have a fungal infection acquired by contact with bat guano. Bat and bird droppings are what's going to give you histoplasmosis. We know that it can cause lesions in the lung. Even though we didn't talk about destructive calcific lesions, anything coming from bat guano you're going to want to associate with histoplasmosis on step 1. Blastomyces dermatitidis also has a predilection for the Mississippi, Missouri, and Ohio River valleys. It's associated with rotting wood and can also cause an asymptomatic lung infection. Then you get dissemination and you get ulcerated granulomas in the skin, bone, and other sites. This map up here shows the blasto belt and also the histo belt. where it's blue and red, you'll find both species. But you can see there above Georgia and kind of South Carolina, North Carolina, you can still get a lot of blastomyces where you don't get a lot of the histoplasmosis. Environmentally, blastomyces looks as this figure shows with microconidia. Once you see it in the body, though, you look for the broad budding yeast. You'll have septate hyphae, conidia, and a thin lollipop conidiophores in the environment, but again, the broad-based budding yeast in the body. These are clinical pictures and microscopy showing the yeast form with the broad-based budding, and also you can see the destructive lesions on this gentleman's nose. Question. A fungal infection acquired from rotting wood in Mississippi River Valley and forming ulcerated granulomas in the lung is characteristic of blastomycosis. If they would not have said the rotting wood, but would have said soil associated with bird droppings, you'd have to think more carefully about histoplasma, even though it doesn't cause ulcerated granulomas in the lung. It can cause calcific lesions. Next question. A broad-based budding yeast in tissue cultures and septate hyphae with a lollipop conidiophore is characteristic of blastomycoses. Up next we have Paracoccidioides brasilensis, which is found in Central and South America. The Brazil helps you remember that. It's a frequent cause of asymptomatic lung infections, but then you get dissemination with destructive lesions in the mouth and nose. You'll find it for some reason in males more than females, and you look for the ship steering wheel morphology of yeast, as you see here in the figure on the right. Question. A Latin immigrant during an employment health check is discovered to have a patchy bilateral pneumonia and a lung mass. Biopsy of the mass demonstrates fungal organisms with very few distinctive mariner's wheel yeast forms. Which of the following is the most likely diagnosis? Again, Paracoccidiomycosis has the mariner's wheel, and also this is somebody who's coming from South America where Paracoccidiomycosis brasilensis is more likely to be. They tell us it's a fungus. They give you everything you need to know in order to answer the question. Coccidioides immitis is frequently found in the southwestern United States, like California and Arizona. It's a frequent cause of asymptomatic lung infections, again in males more than females. It can cause a flu-like illness, which is known as San Joaquin Valley fever, with a cough and fever, and you can get erythema nodosum, which is red, tender subcutaneous nodules on the shins. This is a delayed or cell-mediated hypersensitivity reaction. When you look in the infectious form, you can see cylindrical arthroconidia with arthrospores, and you look in the diagnostic form, you see endospores in spherules. Here are some clinical pictures of this endospore with spherules inside of it. Also, you can see the characteristic lesions on the hand and foot. You treat coccidioides with fluconazole or amphotericin B. Question. A 25-year-old male presented with fever, cough, with productive sputum, bone pain, and a tender erythematous shin nodule following a visit to Arizona. Sputum exam reveals spherules containing endospores. The most likely pathogen is. So this question really gives it to us. They give us the geographic location, they give us the erythematous skin nodules, or erythema nodosum, and then we've got the spherule containing endospores. This has to be Coccidioides immitis. On his return from Bakersfield, California, a previously healthy 36-year-old male presents with a fever and cough and red, tender subcutaneous nodules on his legs. The tissue diagnostic form of this likely fungal agent is. So this is the same question except for turned around. So we know that it's Coccidioides immitis. They don't tell us that name, but they do want us to know that the tissue diagnostic, and that's the endospores and spherules, as we just talked about previously. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Module 42. We're going to talk about systemic mycoses. These are very clinically important mycoses, and they'll show up frequently on the test. We'll talk about histoplasmosis, we'll talk about blastomycetes, we'll talk about coccidiomycosis and paracoccidioides. These are important clinical diseases. We'll go through each one of them, talk about their clinical features, how they present, and what we do to diagnose them.